So moving right along, sleep again is something that we tend to think of as a luxury, but it's actually again a necessity. I know that to some people it seems like a waste of time, but there are a lot of very important processes that take place when we sleep. And for example, synthesis and regulation of essential hormones and proteins, such as the sex hormones, cortisol, and pancreatic enzymes. So you might notice, for example, if you're not sleeping enough, that your digestion just isn't very good, or that maybe your libido is impaired. And so those are important considerations. In addition, when we sleep, our immune system kind of gets back sort of in shape and is better regulated. And when they look at studies, or I think they don't do this anymore, but when animals have been deprived entirely of sleep for a period of time, they actually lose all of their immune function and die within weeks. In addition, when we sleep, we are able to recover from injury and illness. So that's something important to consider. And as you can guess, getting less is not more. So anything less than 6 or 7 hours of sleep has increased risks. So folks find it harder to lose weight, for example, and tend to weigh more. Folks who sleep not enough tend to have more high blood pressure. There's a higher incidence of heart attacks and stroke. There's double the risk of diabetes, which is kind of a lot. And there's also a threefold increased risk for colds and respiratory infections, which again, during a pandemic isn't so great. And so why does all of this, why does this risk occur? Well, there are multiple reasons, but a couple of the most prominent causes are activation of the sympathetic nervous system and autonomic dysregulation. So it's again that fight or flight that's just chronically being activated. And with this comes increased cortisol and norepinephrine secretion, as well as increased inflammation, which leads to increased plaque formation. And so, I put in here that we have to remember that there are no makeups, only breakups. So this idea of making up for lost sleep on the weekends, for example, is kind of, a falsehood. They've looked at, sort of performance, and it turns out that grade point average is inversely proportional to the amount of discrepancy between your weekday sleep and your weekend sleep. So if you're getting 5 hours of sleep or 4 hours of sleep on the weekdays and getting 8 hours of sleep on the weekends, then your GPA will tend to be, X points less. And in the workplace, that just translates to, poor performance and poor outcomes, which nobody wants. All right, so now that we've talked about inadequate sleep, what about too much? Is it possible to get too much sleep? Well, interestingly, getting more than 9 hours of sleep on the whole, not for individuals, but looking at large populations, this amount of sleep is also associated with similar cardiac risks. So there are increased risks of heart attack and stroke, as well as increased risk of diabetes and an increased risk of death. So we don't know exactly why that's true, but it may be that excess sleep is a marker of other underlying health issues, such as cancer or depression. And interestingly, excess sleep may also be associated with lower socioeconomic status, which is an independent risk factor for heart disease.